Hey y'all, it's Daniel, and I'm here to give you the Core Ambassador update for the month of March, April, and early May. Really, it's been a busy past couple of months. Because we've been planning events for this year's TPTA Student Assembly, and that's going to be held in the late October in San Antonio. And we've also been busy touching base with several of the National Advocacy Dinner events that were hosted this year in Houston, Dallas, and El Paso. Congratulations to each of the committees that worked hard in hosting these events, and you can follow up with our blog post about those events written by Ali Beck from TWU Houston. This video is kind of a little more specialized, and essentially I gave my in-service on this and also wrote a blog post about this event, but I wanted to make it more accessible to all you guys, so I decided to make a quick recap video as well. And again, it's not 100% comprehensive, but it's just a couple key takeaways from the 2018 APTA Federal Advocacy Forum. So, the Federal Advocacy Forum is a national conference held by the APTA every year, much like the Combined Sections Meeting, NEXT, and the National Student Conclave. This event, FAF, is held each year in Washington, D.C. in late April, early May. And essentially it is a conference more geared toward advocacy and legislation. It's a 3-day event held on a Sunday and Monday, where those first 2 days are essentially just different classes that you can select, kind of like in CSM, where you can choose to sit in on a class that is more catered to your interests, and the classes kind of vary. Some of them, one of the ones I went to was social media based and how to utilize social media as a means and tool for advocacy, and other ones are more informative that kind of give you a rundown on some of the policies that are going down in the House and Senate this year. And so those 2 days, it's really just kind of in order to prep you for Tuesday, which is basically the big day for the Federal Advocacy Forum, where we actually walk onto Capitol Hill and talk with representatives from the House that represent your city and your region, as well as senators, the 2 that represent Texas. And as intimidating as it does sound, they do a really, really good job of preparing you guys, and especially because Texas has a really great regular attendee rate, I guess. So of the whole conference that has like about 300 participants, there are about 30 or so from Texas, and several of them are veteran advocates that go every single year. So there are 18 of the students, but the rest 10 plus are regular attendees that kind of model and showcase what it means to advocate. And so, big picture again, 2 days of prep work, 1 day of actually going to the Hill and talking to staffers and representatives from your area. Here are a couple of pictures just real quick again. You'll just see several students from Texas in the top left and right hand corners, and then the middle picture at the bottom here is all 30 plus attendees from Texas that went this year. We had strong representation, but of course every year we're looking to expand our presence, and hopefully next year we can break records even more. Just to give you a recap of some of the things we did talk about, I'll just keep it down to 3, but there are several more topics that we did bring to legislation. The first of which was an action item called Connect Act, which you'll see the corresponding House and Senate bill numbers, but APTA decided to support this act because it would ease restrictions on telehealth. And if you guys don't know what telehealth is, it is just a means for us to provide physical therapy services electronically. And this is a resource that physicians and nurses already use, and we're just trying to expand our practice and be able to utilize that technology as well when it comes to these 3 different patient populations using Medicare Advantage, accountable care organizations, and other certain bundled payment programs. But basically what it is, and you can see these last two bullets here, it improves access for patients in rural communities, and this is especially important in Texas where over 40 counties don't even have a physical therapist in their county, and so these patients are having to travel multiple hours just to get physical therapy services. So in us being able to utilize technology and Skype into home visits to do fall risk assessments, to kind of follow up with patients on their home exercise programs, if they're doing it well, if they can adjust it in this amount of way, it would really kind of help us access our patients, and the patients help access us as well. So it kind of works twofold, and the APTA decided to support this act when we brought it up to the staffers as well. The second thing we brought up was the Prosper Act, and the APTA decided to oppose this act because what it is, it places an arbitrary cap on federal student loans, thereby decreasing access to physical therapy school. As you can see here, the annual limit would be capped at $28,500 a year with a graduate limit of a total of $150,000 for federal student loans. And specifically in regards to some of the private programs in Texas, but also if you're out of state, whatever you find yourself, you can just put the math together and see that tuition alone can bring you to this amount, and that would really kind of put a burden on students to take on loans from private lenders and just find other means to find and fund their schooling. So again, it decreases access to physical therapy school, which is already has enough barriers as it is. So the APTA decided to oppose this act, and you can read more about it on the website. The last thing that we brought up to staffers, whether it was the representatives in the House or representatives, senators, is not necessarily a specific policy, but it was kind of a conversation to have about the physical therapist's role in the national opioid epidemic. I included a couple statistics here just to, of course, as you can see, just increase awareness of this issue. Many people, as you can see, thousands are dying each year from overdosing, and this kind of just puts an economic burden across the board, whether it's hospital funding, whether it's pharmaceutical funding, this and that. It's calculated up to $78 billion a year. That's a financial burden. So as you can see, it really is a public health crisis in the United States. And while there's no one policy that we introduced into legislation, we just want to educate our representatives on the fact that physical therapy is a part of an integrated team approach because it is a complex multidisciplinary issue, and it should be attacked with a multidisciplinary team approach as well. And so I guess what we were really driving home is that physical therapists should have a seat at the table, because when we talk about opioids, we're talking about pain control. Physical therapy is one key way that people can address pain in a non-pharmacological way. And so we really were pushing for just early access to PT services, and also just setting the standard to say that this already is a standard of care in the military, and it has been working, this direct access path, and there have been good results. And so if we can try physical therapy early, it can be something that is cheaper and more safe to do than giving opioids right off the bat. And so again, we were just kind of informing our staffers to really just educate to them about our profession, and to #ChoosePT, which is ironically enough the campaign we've been running through. And so those are the big topics we came away from the Federal Advocacy Forum. And just to drive home a couple things you can do to advocate locally in your area, which was included in my last video, but I'll run through it real quick, is one, to write to your representatives. And the APTA made an app called the APTA Action App, and you can look it up on the Google App Store or the Android App Store, Apple App Store, whatever it is, and it'll bring up to this page. And when you click on this little link on the top middle button, it brings you to these pages where you really can just read about the issues, click on the hyperlinks that say take action, and it gives you an auto-scripted template that the APTA already made about specific issues. And all you have to do as someone who wants to write to a representative is click go, that link at the very bottom of the page, and I'll automatically send that link to your representatives explaining what the issue is and why we support or not support the issue. So it really only takes about 30 seconds or less to write to your representatives. And the last thing I want you just to consider is just to post to your social media today to hashtag ChoosePT. And again, just kind of educating your patients, educating your friends and family about physical therapy, our profession, and how we as a profession do address pain every day, and it could be a great alternative to opioid use.